your talk yesterday, you were talking a lot about personalised treatment of cancer today. You also mentioned, though, that every tumour is unique, every patient is unique. So the question, I guess, is how far can we go with this personalisation of treatment?
I think the current setting is that we are doing really putting people in very big boxes. So if you have a tumor in a given site of the body, and if it has a given stage in terms of how advanced it is, if maybe we know the histological grading, if it's a very aggressive, microscopically very aggressive tumor, you would get into one of these boxes, and everybody in a box would get the same treatment. They would all have chemotherapy or surgery or radiation therapy, or maybe a combination of the various modalities. I think what we are beginning to learn now is that within these big boxes there's a huge variability in how a patient responds to treatment, and therefore by implication there's a huge variability in what the optimal treatment would really be. So finding the best possible package deal for an individual patient, that's what we call personalized.
So you also talked about founding a new transdisciplinary field of science, which you're calling clinical biophysics.
Yeah.
And this would involve bringing together methods and technologies from several different existing disciplines. And you also said that physicists should sit in the middle of this new field. Could you expand a little on that and say what the role of physicists would be in this new field of clinical biophysics?
Yeah, that's true. Yes, that was sort of a vision for, as you said, this is transdisciplinary. It's not interdisciplinary in the old sense that you look at the interface between medicine and physics and biology in this case. I see it more as a new type of science, a new scientific area. And I think physics comes last in this, a new construction of this word. It is the idea that you will combine methods and knowledge from many different sciences into some kind of super science. And again, I think physics and technology will be at center stage, up front and center in this effort. I think actually physics is the natural science. It's the sort of overarching natural science encompassing all the other sciences as sort of limiting cases. I think the physicist would naturally be at the center of a lot of these things.
So by training, you yourself are both a physicist and a medical doctor. So a young person now who's maybe heard your presentation last night or has heard about the conference this week and they want to follow in your path, what would they have to do? What would you recommend to them to achieve what you've achieved?
This is a growing field, and I think there will be lots of opportunities in the future. I think there will actually be more and more opportunities. There are no specific training or education that is aimed at this field. If you want to go into this kind of business, I would still believe that medical physics or physics in general would be a great starting point. I think it's a great entry into this field. I would encourage you to try to educate yourself as broadly as possible. I would suggest that you try to take courses on biology, maybe even philosophy, maybe on mathematical modeling, whatever. And then of course you need a little bit of luck.